Everyone, happy morning, a very good morning. I hope and I believe all of you are doing well. Before we even start talking and discussing, a quick note whether the audio visual is all good. I hope I'm audible and visible, everyone. Yes, sir. Sandeep or Sandeep, basically, it was stuck, I think, and I hope it is better now, and the entire screen is now visible. So was just trying to cater to that. Okay, great. So happy morning, everyone. I hope and I believe all of you are doing well. And so today we are kickstarting this last minute binge revision for NEET PG 22. Why today? Because we are starting with the new timetable. So anyone who's appearing for NEET PG 22 and you don't have a timetable, or you make a timetable and you fail to follow it, you can follow this timetable that we have started yesterday, but it started with a grand test day. The subjects are starting today, that is 31st of January. So today and tomorrow, our target is to complete anatomy, right? More so for you, that means you have to revise entire anatomy in 2 days, today and tomorrow. And that's the reason that today I am going to discuss a topic from anatomy, like we discussed in the yesterday's 5 p.m. class on Unacademy. What topic do you want to be discussed in the 9 a.m. class? The cranial nerve functional columns. Many of us find this topic very confusing, but I try my best to make it very, very simple for you. Basically, there are those amazing cheat codes which help you remember which cranial nerve comes in which column. All right. So that is what we would be seeing. And the plan for the rest of the day today is that 5 o'clock on Unacademy app, basically we have the free live classes. So whatever will be the daily target, like today is anatomy. So today 5 p.m. we are going to have anatomy binge revision, basically all the important topics, starting from head and neck to your lower limbs. I'll just pick up few most important topics that are expected in your exam, and that is what we would be revising. Is this only for NEET PG students? No, this is for everyone, right? If you are a first year student reading anatomy, if you are a FMGE student, anybody can attend these classes and learn out of this. The earlier you learn the mnemonics, the better it would be, right? So basically, I would be discussing the anatomy mnemonics, the cheat codes on remembering the difficult topics in anatomy in the 5 p.m. class. I'll be posting the link in the comments and in the description of this video and on Telegram group as well, so you can enroll for the same. Plus, we had decided that we would have a pre-test and a post-test for the daily target, because 9 a.m. we have the class, so we'll put the pre-test at 10 a.m. and 9 p.m. we will have the post-test for the daily target. So today and tomorrow you will have anatomy pre-test and post-test. So what I want you to do is see how much you are scoring in the pre-test. Once you have read anatomy, you have the post-test, see how much you are scoring and how well you have improved. So where will these be conducted? These would be on the Telegram group, Dr. Nikita's Radsynapse. So these are live only quizzes. You have to be there at that time to give those quizzes and see the explanations. Otherwise, they won't be available later on, right? So this is how generally the plan of the day would look like. So 9 a.m. the class on the YouTube channel. 5 p.m. we would have on Unacademy app. Those are going to be the free live classes. All of you can attend. Okay. So let's gear up and get ready to prepare for NEET PG 22. So everyone tell me, how's the Josh? How's the Josh? I want to hear from each one of you. I'm seeing your live chat. So let's kickstart our days with the 9 a.m. Sessions. Pre-test is going to be at 10 a.m. now, because 9 a.m. we have the live class on YouTube channel. Okay, so that's why we have shifted the time to 10 a.m. for pre-test. After this class we will have. Okay, amazing. So hi everybody, I want to hear from you. That's super awesome. Okay, so whenever you feel low, ask yourself how's the Josh, and you would get all motivated and have all the energy and momentum to study. So let's start with a pre-test, a pre-session sort of question here. All of the following cranial nerves contain somatic efferent except which of the following? All of the following cranial nerves contain somatic efferent except which of the following? Cranial nerve 4, 3, 7, 6. What do you think is the answer to this, everyone? If you are confused when you see this question and you are like, oh my god, I don't remember, then this session is exactly meant for you. Okay, so the correct answer is 7. We'll come to this discussion and I'll tell you the cheat codes on how you could get this answer right. Suppose even if you have not read this topic, right, and you get this question in the exam, this is actually a previous year question. Just try and categorize the cranial nerves 4, 3, 6. These are the cranial nerves which supply the extraocular muscles. That means this is something related to your efferent, the motor to the eye muscles. 7 does not supply. So that is the answer, right? So use those logical guessing, the cheat codes that help you score more in the exam, right? They really help you. Odd man out, absolutely. Okay, so let's start discussing this topic here. So tell me, you have the basal plate and you have the LR plate, right? We have the basal and we have the LR plate. Which is anterior and which is posterior? Which is anterior and which is posterior? Basal plate and the LR plate, which is anterior and which is posterior. Anyone? So the quick mnemonic here, guys, make a quick jot down of the mnemonics in your notebook, because even I'm realizing that there are so many mnemonics that I don't have a compiled version, but that help you in the last minute revision. Okay, LR is posterior, basal is posterior. Nikunj has answered both. LR is aage. Are you sure? LR is anterior. Basal is anterior. So I see a lot of confusion here. So let's remember this as ABPA, right? We all know the disease ABPA, allergic bronchopulmonary aspergillosis. Remember from that. So B and A, those are basically your plates, the basal plate and the LR plate. So this is anterior and this is posterior. So anterior is basal and posterior is LR. Okay, and now tell me which is sensory and which is motor. Which is sensory and which is motor? Your cranial nerve, the columns, the sensory and the motor. Which is sensory and which is motor? So remember that LR is no, Varun, LR anterior nahi hai na, LR posterior hai. LR is afferent. Okay, remember the other trick here. I see a lot of confusion here, guys. Please remember with the mnemonic so that you remember forever that LR is afferent. That means afferent means it is sensory. So that becomes that basal becomes your efferent. That means it becomes your motor, right? Logical thing here, basically, think logically also. In the spinal cord, you have the anterior column and you have the posterior horn, right? The anterior horn and the posterior horn. Which one is sensory? Which one is sensory? Right? Poliomyelitis yaad hai sabhi ko? We all know the disease poliomyelitis. Basically, it is the motor one where the muscles become weak, and we know that it affects the anterior horn, the lower motor neuron, right? So that is your motor is anterior. That means it is anterior wala is efferent, right? And which plate it is? Which plate it is? ABPA. Anterior is the basal plate. Is this clear with everyone? We know that the dorsal column, the posterior horn is the sensory one, right? The anterior horn is the motor one. So look at this one here. That means sensory afferent is your posterior. That is the LR, right? So LR is afferent and efferent is basal. Clear with everyone? So the mnemonic that we have learned is ABPA. Anterior is basal and posterior is LR. And LR is afferent, right? LR is afferent. Clear with everyone? Posterior is afferent, LR is afferent. Okay? Anterior horn is motor, basal plate is motor, right? Okay, now going to the cranial nerve functional columns. So basically we have the afferent columns, that is the sensory columns, and we have the efferent columns, that is the motor columns, right? Now, which even in the afferent and the efferent, we have somatic, we have visceral. Okay, so we have somatic columns, we have visceral columns. Somatic means from the body. The sensation may general sensations. Somatic efferent means it is your the skeletal muscles basically. Visceral means the viscera inside, the intestine, the cardiac. So when I say visceral afferent, right, it is your, if it is general visceral afferent, it is your pain of angina, the intestinal colic pain, that is the general visceral afferent. Okay, so first of all, understand this concept, like you have afferent and efferent, sensory and motor. Even in that you have somatic and visceral, and you have general and special. So what are the columns that we have? We will be having a look on that. Okay, so we have general somatic efferent, we have special visceral efferent, general visceral efferent, general visceral afferent, special visceral afferent, general somatic afferent, and special somatic afferent. Which column is not there? If you do the permutations and combinations, there should be 8. Here you have 7. 1, 2, 3, 4, 5, 6, 7. Which column is not there? There is no column called as special somatic efferent. Right, there is special somatic afferent, but there is no special somatic efferent. Okay, remember this. Now looking at some quick tricks. Okay, looking at some quick tricks here. I hope you are able to read what I have written. So in the somatic columns, we said that you don't have special somatic efferent, you have general somatic efferent. When I say efferent means motor, going to the muscles. It is somatic efferent, so going to the skeletal muscles. And general somatic efferent basically is your ocular and tongue muscles. Okay, general somatic efferent is your ocular and tongue muscles. These are the skeletal muscles. So ocular and tongue muscles wala 3, 4, 6, eye muscle supplied by 3, 4, 6, tongue supplied by 12. Right, so 3, 4, 6, 12 is your general somatic efferent. Okay, then you have general somatic afferent. Afferent matlab sensory. General somatic means carrying general sensations from the body, right? So pain, touch, temperature. This is your general somatic afferent. Now it is the cranial nerve which carries the sensation, the general sensation from the face, trigeminal nerve, right? The trigeminal. So the major one here is 5. Some books also include 7 and 10. I'll come to that as well. Okay, so trigeminal carries the general sensations from the face, so it is sensory, afferent, general, and from the face, that is somatic. Okay, but remember here, very important point, that which nucleus of trigeminal nerve is not included in your afferent? The motor one, right? The motor nucleus will not be included because motor is efferent. The rest of them, that is the main sensory, the spinal, the mesencephalic, which carry the sensations, they are included. Motor is not included. Okay. Now special somatic afferent. Afferent matlab sensory. Special somatic means carrying a special sense from outside the body. Now which is the special sense from outside the body? These ears are like, the out projections from the body. These are outside. So that is your hearing. So hearing, basically the cranial nerve 8 is your special somatic afferent. And we don't have special somatic efferent. So basically we have learned about the somatic columns, right? Somatic basically means the general wala. Okay, bahar ka body, skeletal muscles or the general sensation. You have general somatic efferent. Right, if you want, I'll write it down like this. You have the afferent column, you have the efferent column. Even in the afferent, right, afferent matlab sensory from the body. We have general somatic afferent, we have special somatic afferent. We have general somatic efferent. Do we have special somatic efferent? No, we do not have. The special somatic efferent is not there. Okay? Now general somatic afferent, how do I want you to decode this? Afferent matlab sensory, general somatic means general sensation from the face, that is your trigeminal nerve. Except which nucleus of trigeminal? The efferent one, that is the motor nucleus. Special somatic, special sense where you have hearing from the body, that is your cranial nerve 8. General somatic efferent, that is motor to the skeletal muscles, ocular muscles and the tongue muscles. So you have 3, 4, 6 and 12. Easy. Everyone give me a quick thumbs up if this is clear. With the somatic components, that means out of 7, if you see the 3 columns are done, right? We have total 7 columns because 1 is not there. Everyone a quick thumbs up so that we can proceed ahead. Any queries so far? Any queries here? Or otherwise give me a quick thumbs up so that we can proceed ahead. Quickly, I'm waiting for your thumbs up, everyone. Yes, okay, that's great. Now go to the visceral columns. Okay, what do we have in the visceral? Again, in the visceral, we will have afferent and efferent, and we will have general and special, right? So what are the columns that we would be having? We will have general visceral afferent, general visceral efferent, special visceral afferent, special visceral efferent, right? So these are the 4 columns that we would be having in the visceral. Now what do we understand by visceral? That means from the viscera, the heart, the intestine. This is basically your visceral. Okay, now in the efferent, okay, in the efferent, general visceral efferent and special visceral efferent, very easy to remember that. General visceral efferent, when I say, basically it is your parasympathetic cranial nerves. So remember, it is visceral efferent, that means motor going to the viscera and the general one. That means viscera, we know basically viscera is controlled by your parasympathetic system, right? So remember, general visceral efferent, that is your parasympathetic. Viscera are controlled by autonomic system, right? So which are the parasympathetic cranial nerves? 3, 7, 9, 10. Okay, so the cranial nerves are 3, 7, 9, 10. These are the parasympathetic. So these become your general visceral efferent. Okay. Special visceral efferent are basically your branchial arch muscles. This is a misnomer. The branchial arch muscles, the muscles of mastication, right? The muscles of palate, pharynx, all of those, they are skeletal, but still they come under the special visceral efferent. Imagine like the branchial apparatus is a very special apparatus. So branchial arch muscles are your special muscles, right? These are not special somatic efferent. We don't have that column. It is special visceral efferent. Now, in our topic discussion of branchial apparatus, we have discussed what are the cranial nerves. Start with the odd number 5. First one is your 5, then you have 7, then you have 9, and then you have 10, 11. 5, 7, 9, 10, 11. I'll come to the nucleus also later on. In the afferent, you have general visceral afferent and special visceral afferent. Both of them is 7, 9, 10. Okay, both of them is 7, 9, 10. So basically, it is your nucleus tractus solitarius, right? When I say nucleus tractus solitarius, N for 9, T for 10, and S for 7. These are the cranial nerves. Again, an important question. 9, 10, 7 are included. This is your 9, 10, 7 or 7, 9, 10. Now, if you make a note here, a very important note here, the cranial nerve 7, 9, 10 comes in GVE, 7, 9, 10 comes in SVE, 7, 9, 10 comes in GVA and SVA also. That means basically all the visceral columns will have 7, 9, 10 cranial nerves. Okay, all the visceral ones will have 7, 9, 10. Okay, all of them will have 7, 9, 10. 10 तो आपको पता है, vagus, major, parasympathetic, तो वो हर visceral column में it will be there. So 7, 9, 10 is present in all the visceral columns. Now parasympathetic GVE, what is the nucleus that you have? Let's have a look at the nucleus. Okay. So for the cranial nerve 3, which is the parasympathetic GVE wala nucleus, that is your Edinger-Westphal nucleus. How do you remember this is? Remember it as when you write 3, uska ulta is E, right? So that is for cranial nerve 3, it is Edinger-Westphal, right? 7, when you write 7, S for superior, right? It is superior salivatory nucleus. After 7 is 9, inferior to 7 is 9, so 9 is inferior salivatory nucleus. For the cranial nerve 10, the nucleus which is included in GVE, this is a previous year question, is the dorsal nucleus of vagus. Okay, you have the dorsal nucleus of vagus in GVE. Clear with everyone? What is nucleus ambiguous? It is 9, 10, 11. Okay, ambiguous is 9, 10, 11. NTS is 9, 10, 7. So let us quickly revise here the visceral columns. Okay, what did we read about the visceral columns? So in the visceral columns, again you will have efferent and you will have afferent, right? Efferent is motor, afferent is sensory. You will have general visceral efferent, special visceral efferent. General visceral afferent, special visceral afferent. Tell me what comes in your general visceral efferent. Right, motor to the viscera, general. Viscera are controlled by autonomic nervous system. So the parasympathetic, 3, 7, 9, 10. Special visceral efferent, your special component is the branchial arch muscles, right, which are the cranial nerves. 5, 7, 9, the odd numbers. Then you have 10, 11, that is your nucleus ambiguous, right? After that, the next one that you have is, okay, the next one, general visceral afferent, special visceral afferent. Both of them is nucleus tractus solitarius, 9, 10, 7. Okay, 9, 10, 7. So Sandeepa, 3, 4, 6, 12. Tell me where does 3, 4, 6, 12 come? So think logically. 3, 4, 6, 12. Supplying the eye muscles and the tongue muscles. That is the skeletal muscles, not arising from the branchial apparatus. That is your general somatic efferent. Okay, this is your general somatic efferent. Branchial arch muscles is special visceral efferent. Right, that is your special visceral efferent. Your visceral muscles, cardiac and intestine, that is general visceral efferent. Okay, that is your general visceral efferent. Now tell me which sensation comes in your special visceral afferent. Remember the taste, right? The taste from the tongue. How you can remember is, tongue is inside the body. It's not like, always projecting out like the ears. Ears is special somatic afferent. Taste is inside. It is your viscera. Like the viscera, like an organ, it is inside. So remember, taste is special visceral afferent. And we know that taste is carried by nucleus tractus solitarius. So 9, 10, 7. Okay, 9, 10, 7. Clear with everyone? So we are done with the 7 columns if you see. Let us quickly revise this. Okay, and let me tell you some quick mnemonics. Where did that go? Just give me a second. Okay, so never mind. Let us see this. So the quick mnemonic to remember here, basically in the somatic and the visceral, if you want to solve the questions very fast, you are short of time. So in that, remember that somatic, when I write somatic, S is like number 2. Okay, S is like number 2. That means it is even numbers. Okay, the even cranial numbers. Okay, visceral, when I write visceral, I is like 1. That is the odd number. So you have the odd cranial nerves in the visceral columns. Okay, you will when we will compile all of this, you will get to understand. So remember, somatic is 2. That is the even numbers. Some books say even the optic nerve is your somatic afferent. Okay, it is the eye wala special somatic afferent. So starting with your 4, 6, 8, 10 and 12. Okay, now think logically, and whatever we have discussed out of this, which of these odd number cranial nerve does not come in the somatic column? Which of this odd number cranial nerve does not come in the somatic column? Yes. Which of these does not come in the somatic? It is visceral. The major supply to the viscera, the parasympathetic. Parasympathetic. Visceral is basically your viscera organs. Remember, that is your parasympathetic. So remember that 10, okay, 10 wala will not be included in your somatic column. It will go to the visceral column. Very obvious, because 10 is vagus and vagus goes to the viscera, right? The heart, parasympathetic, intestine, parasympathetic. So vagus nahi hoga. Uske baad mein kaun sa wala odd number will be there in the somatic? Which odd number will be there in the somatic? 3 रहेगा, राइट, क्योंकि ऑक्यूलर मसल्स 4/6 है. अगर आई के मसल्स के 4/6 इधर है तो 3 भी उसके साथ जाएगा, बिकॉज 3, 4, 6 टुगेदर. दीज आर द एक्स्ट्रा ऑक्यूलर मसल्स. क्रेनियल नर्व 5 will come because 5 carries your general sensation, somatic from the face, external somatic, general sensation. So 3 and 5. Okay, 3 and 5. Otherwise, it is 4, 6, 8, 10. 10 is not there, 12 is there. Okay. Now tell me the visceral mein. Okay, visceral mein the odd numbers. What will you have in visceral? Starting with the odd numbers, you have, let's say, 3, 5, 7, 9, 9, 11. Okay, 3, 5, 7, 9, 11. Out of this, which odd number is not there? Any odd number is not there in the visceral? All the odd numbers are there, right? Cranial nerve 3 कौन से column में आता है? Visceral column में. Cranial nerve 3 comes in your which visceral column? The general visceral efferent. It's a parasympathetic nerve, right? It is one of the parasympathetic. It comes in your general visceral efferent, right? It comes in your general visceral efferent. Which is the even number which will come in visceral? You have to add cranial nerve 10. Vagus, of course, is visceral. All the visceral columns will have 7, 9, 10, right? All the visceral columns will have 7, 9, 10. Okay, they will have 7, 9, 10. Your cranial nerve 5 comes in which visceral column? General visceral efferent? No, it's not parasympathetic. Special visceral efferent? Yes, branchial arch muscles, right? The branchial arch muscles, it comes there. Visceral afferent में तो 7, 9, 10 है. Is everybody understanding this? Right? Clear with everyone? So, remember that somatic is 2, that is odd, even numbers except your 10, and you have to add the odd numbers 3 and 5, and you have the visceral I, that is your odd numbers. That is your 3, 5, 7, 9, 11 and add 10 to it. Okay, add 10 to it. Now let's have a quick look at the cranial nerve columns here. So look at general somatic efferent, the eye and the tongue. 3, 4, 6 and 12. Special visceral efferent, the branchial arch. 5, 7, 9, 10, 11. Branchial arch is special visceral efferent, right? So 5, motor nucleus of trigeminal, it is the efferent. Then you have facial motor nucleus, and you have 9, 10, 11 nucleus ambiguous. Okay. General visceral efferent, parasympathetic 3, 7, 9, 10. 3 Edinger-Westphal, superior salivatory, inferior salivatory and dorsal nucleus. Plus lacrimation, of course, is there, 7 wala. GVA, SVA, visceral afferent is your NTS, 9, 10, 7. GSA, general sensation, trigeminal, chief mesencephalic spinal. The motor nucleus is not there. Special somatic afferent, somatic bahar, special sensation hearing, vestibulocochlear nuclei. Everybody, is this very, very much decoded? Easy, right? You just need to decode the term. जब मैं बोलूँ general somatic efferent, motor, general somatic मतलब skeletal muscles, eye and tongue वाला, ठीक है? Special visceral efferent is branchial arch, general visceral efferent parasympathetic, special somatic afferent is your hearing, general somatic afferent is your pain, touch, basically the trigeminal, right? It's easy. Now going to this final one, let's see one by one the cranial nerves. Okay, so now we'll do one by one. The cranial nerve comes in which columns. उसके पहले चलो एक बार ये ना MCQ solve कर लेते हैं. These are the previous year questions. All of the following pairs regarding the neural columns are correct except you have the nucleus given and you have the column given. Tell me what is the answer to this. So how you should be thinking in such questions? हाइपोग्लॉसल न्यूक्लियस, ओके, हाइपोग्लॉसल न्यूक्लियस GSE, इसको ऐसा सोचो, इफ्रेंट मतलब मोटर, जनरल सोमैटिक आई एंड टंग, हाइपोग्लॉसल टंग, yes it is, okay, yes it is. After that tell me the what is the answer to this question. Very good, Mehboob, the answer is C. I'll come to that. You have nucleus ambiguous, okay, nucleus ambiguous, branchial arch SVE, correct. Dorsal nucleus of vagus, it was GVE, not GVA, because in GVA and SVA both of them have nucleus tractus solitarius, right? You don't have this dorsal nucleus of vagus. Dorsal nucleus of vagus is GVE. NTS is SVA. Tell me which is the sensation in the special visceral afferent? Which is the sensation in the special visceral afferent? Which sensation comes under? It is your tongue. That is the taste sensation, NTS. Okay, that's your NTS. Okay, remember the visceral afferent is your NTS, be it general, be it special. All the visceral columns have 7, 9, 10. All the visceral columns have 7, 9, 10. Okay. Next one, all of the following cranial nerves contain somatic efferent except. So this is the question that we saw in the beginning of the session, the pre-test wala. You have somatic efferent, right? Somatic efferent, you have only general somatic efferent. You don't have special somatic efferent. The eye and the tongue muscles. So eye muscles 3, 4, 6, tongue muscles 12. That is 3, 4, 6, 12. So 7 is not there. Okay, 7 is not there. If you also remember the cranial nerves 3, 4, 6, 12 are the ones which are medially located in the brainstem. If this is the midline, 3, 4, 6, 12 are located medially, right? They will go in the medial brainstem syndromes. Cranial nerve 12 is gone in medial medullary syndrome, not in the lateral medullary syndrome, right? So remember this point. 3, 4, 6, 12 basically जिसके टेबल में 12 आता है वो cranial nerves medially होती है. 3, 4, 6 सबके टेबल में 12 आता है. 3 4s are 12, 4 3s are 12, 6 2s are 12, 12 1s are 12. So these are located medially. Okay. Next one, nucleus tractus solitarius receive fibers from all of the following cranial nerves except which one? Nucleus tractus solitarius receive fibers from all of the following cranial nerves except? Right, nucleus tractus solitarius is 9, N for 9, T for 10, S for 7, right, S for 7. Okay, so you have 9, 10, 7. So facial is 7, 9 and 10. It does not have accessory. Yes, absolutely, Nikunj. So remember that in the brainstem, medial are the motor and lateral are the sensory. We have discussed in the brainstem syndromes, right? वहाँ पे हमने discuss किया है the mnemonic that motor nuclei are medial, right? M for M. On the side, that means laterally, you have the sensory nuclei, right? On the side, you have sensory. So cranial nerve 5, 7, 8, all of these come laterally, right? They come laterally. So remember, side में sensory, motor है medial. तो motor में आपका general somatic वाला 3, 4, 6, 12 ये आता है medially. Okay, these come medially. ठीक है? Next one, all of the following nerves have general visceral fibers except which of the following? All of the following nerves have general visceral. Decode the term. It is visceral and it is general. Right, so viscera में general supply, the general control is by the autonomic nervous system. That is basically your parasympathetic system. What nerves are parasympathetic? 3, 7, 9, 10. Right, 3, 7, 9, 10. So you have 3, 7 and 9. Olfactory is not general. Olfactory is smell, right? So that is your special में आएगा, general में नहीं आएगा क्योंकि olfactory तो special sensation है ना? So going back to this table here, where does your olfactory come? It comes in your special somatic afferent. Okay, so some books call it special somatic afferent में आता है आपका olfaction. In the special visceral afferent, you have only taste. Rest of the special sensations, the vision, the smell, the hearing are considered in the special somatic afferent. Okay? So remember, one is SSA, two is again SSA, carries the vision. 3 में कौन से columns आएंगे बताओ मुझे. Cranial nerve 3. How you should think is it supplies the extraocular muscles, efferent, general somatic efferent, and you have the general visceral efferent also because it is parasympathetic. Are you guys able to see the table or should I zoom it? Right? So remember that in cranial nerve 3, you have oculomotor nucleus, which is your supplying the eye muscles, the motor, except your LR6 and SO4. GVE is your Edinger-Westphal. That is your pupillary control, the parasympathetic wala. Then you have cranial nerve 4. 4 supplies the muscles of the eye, general somatic efferent. 5 may, you want me to zoom? Okay, I'll zoom this. See, cranial nerve 5, it is a mixed nerve, right? Remember all your branchial arch wala, 5, 7, 9, 10, these are mixed. So they will come in afferent also, they will come in efferent also. ठीक है? कौन से afferent में आएगा आपका trigeminal? Special में आएगा? नहीं. General sensation it carries, so general afferent. Somatic or visceral? Is it carrying from the viscera? Trigeminal? No, from the face. General sensation. So it comes in general somatic afferent. Which nucleus of trigeminal does not come? The motor does not come in afferent because motor is efferent. So efferent किसको supply करता है? 5. Eye और tongue muscles करता है? नहीं. Branchial arch? Yes, the first arch. So it is your special visceral efferent, right? The special visceral efferent. Clear with everyone? Okay. Now 6. Where does 6 come? 6 is your motor, so only efferent, and it supplies the eye muscle, so general somatic efferent. Cranial nerve 7. Where does your 7 come? Where does your, I'll go to this one. ठीक है. अब देखो जो 7 वाला है, हमने कहा कि 5, 7, 9, 10 जो branchial arch वाले हैं, they have mixed है, तो afferent भी होगा और efferent भी होगा. 7, 9, 10 if you remember, they come in all the visceral columns. It is in GVE, in SVE, in GVA, and also in SVA. Okay, so GVE is the parasympathetic superior salivatory nucleus 7. SVE is to the muscles, the second arch, stapedius, facial expression, वो सब. SVA is your nucleus tractus solitarius. So 7 is also included in the GSA. You know, according to some resources, the spinal nucleus of 5, it is your 5, 7, 9, everything. So it is included in GSA also according to some books. Otherwise, you can go with 5 only. 8 is your hearing, special somatic afferent, right? 8 is your hearing. The next one that we have is, let me go to the next one. Cranial nerve 9. Again, it is a mixed 5, 7, 9, 10 are mixed. So it has afferent, it has efferent. It comes in all the visceral 7, 9, 10. Remember, it comes in all the visceral. So special visceral efferent as a nucleus ambiguous 9, 10, 11. General visceral efferent, parasympathetic, inferior salivatory. Remember the parotid, it is your 9. Parotid is supplied by the otic, right? The otic wala. GVA, SVA, nucleus tractus solitarius, right? The nucleus tractus solitarius. And again is everything afferent and efferent. Special visceral, nucleus ambiguous. General visceral efferent, remember the dorsal nucleus. GVA, SVA is your NTS, and it is included in your GSA. So 5, 7, 10 are included in your GSA through the spinal nucleus. Okay, the external ear ka kuch part is carried by the 10th nerve, the sensation. So that is why it's included in your GSA. Okay, 11 is your ambiguous SVE. 11 is also included in GSE according to some resources, supplying your basically the trapezius and sternocleidomastoid. So 11 some books include in GSE, okay, the spinal nucleus. Then 12th is the pure motor, general somatic efferent, that is your tongue muscles, right? All the muscles of tongue except palatoglossus, right? Except palatoglossus are supplied by cranial nerve 12. Just give me a minute. Just give me a minute, guys. I need to connect the charger. Okay, so I think this is now clear with everyone. Okay, clear with everyone. So tell me, where all does the cranial nerve 3 comes? Where all does the cranial nerve 3 comes? Chalo, quickly, think logically. 3, is it motor? Is it sensory on cranial nerve? Is it mixed cranial nerve? What kind of cranial nerve is your cranial nerve 3? It is not mixed, because mixed are your 5, 7, 9, 10. Right? So cranial nerve 3, is it a sensory nerve? Is it a motor nerve? Or is it a mixed nerve? First thing that. It is not mixed, because mixed is 5, 7, 9, 10. It is motor because it supplies the eye muscles. So it is definitely going to be efferent. Now what if efferent it is going to be? Somatic or visceral? Somatic, eye muscles. So yes, general somatic efferent. Is it visceral also? Parasympathetic? Yes. So what column? It is GVE, right? It is GSE and GVE both. Will it have an afferent component? No, because it's not a sensory nerve. It's not a mixed nerve. It's a motor nerve. So it will have only the efferent columns. Is this clear with everyone? If I ask you which sensation out of all the special senses, which sensation comes in your special visceral afferent? The one which is inside, okay, that we are not seeing, aise bahar se, that is the taste, that is the special visceral afferent. The rest of them, the smell, the vision, the hearing, all of them are special somatic afferent. Special afferent means the special senses, okay. Taste is your special visceral afferent, which is the nucleus tractus solitarius, okay, the nucleus tractus solitarius. Tell me which cranial nerves will come in the general visceral efferent. A quick review. How you should be thinking. It is efferent, that means the motor one will come, the sensory will not come. Visceral, general viscera, autonomic, that is the parasympathetic nerves, that is 3, 7, 9, 10. Okay, 3, 7, 9, 10 would be general visceral efferent. Which nucleus of cranial nerve 10? Is it the NPS wala or nucleus ambiguous? Which nucleus of cranial nerve 10, or is it the dorsal nucleus? Remember, it is the dorsal nucleus. It is the dorsal nucleus. Where does the nucleus ambiguous go? Nucleus ambiguous 9, 10, 11, 5, 7, 9, 10, 11, the branchial arch, that is the special visceral efferent. NPS is the sensation carrying, it is your afferent. Visceral afferent, both the general and the special visceral afferent. Okay, so I hope this topic of cranial nerve columns is now clear with everyone, right? Just try making the notes for yourself in one page. You should be making notes of this topic with all the tricks to remember. Remember the mnemonics A, B, P, A. That means anterior is basal and posterior is LR. LR is afferent, that means the posterior column of spinal cord is sensory, right? So that was about today's live class on cranial nerve columns. We are meeting again next with many more topics in anatomy, the binge revision of anatomy, of course, with mnemonics at 5 p.m. on the Unacademy app. It's a free live class. If you are asked for a code to enroll, use the code Dr.Nikita, and I'll be posting the link in this video comments in the description and also on the Telegram group. Okay, so thank you so much everyone, and I hope this has kick-started your day for today, and see you at 5 p.m. Till then, goodbye, take care, and keep